What I'm going to show you is the absolute best advice that I can give to any veteran regarding their VA disability.
Whiskey 9 Yankee 7 November Golf, over.
A 0% rating means you have the in-service event, you have the current diagnosis, and you have the Nexus. The hard part is already out of the way, but your symptoms were not severe enough to be compensated. A 0% rating can be increased at any time and is in fact one of the easiest things to do when it comes to VA disability claims. You can log on to va.gov and submit an increase without a VSO and without paying for it in about 5 to 10 minutes. Now the hard part, which isn't really that hard, is knowing if you rate the increase or not. I've done this with mental health and back pain a lot on this channel, so let's go ahead and mix it up a bit and we're gonna talk about migraines. In fact, 0% for migraines is probably one of the most common 0% ratings I see when I have one-on-one meetings with veterans. For some reason, and I'm pretty sure I know why, but the VA loves to give 0% for migraines. Now this isn't fact-based, but if I had to give a solid guess, it's probably due to C&P examiners not accurately recording the veteran's symptoms as they relate to 38 CFR. Now people say C&P examiners are trash all the time, and sometimes you're right, sometimes you're not. And I say this, with everything, there are good examiners and there are bad examiners. But when it comes to your VA disability, what is it that you can do about this? If you follow this channel, then you know the only way to combat this is with hard medical evidence. So instead of relying on your C&P examiner, what you could do is make an appointment with your primary care at the VA. You can send them a secure message and talk about your symptoms. Get that evidence in your records. In fact, the secure message that you send is going to be in your blue button report and a part of your VA MC records. When you talk to your primary care, they may start a treatment plan like prescribe you medicine. A very common medicine that the VA prescribes for migraines is sumatriptan. Once you get prescribed sumatriptan, you now have medical evidence saying your migraines are severe enough to take this medicine. In addition to hard medical evidence, I would also recommend you submit a personal statement, VA Form 21 TAC 4138, and within that form, I want you to discuss your medical evidence saying, I saw primary care and was prescribed sumatriptan on this month during this year, and here are my migraine symptoms, and in fact, here's my migraine log going back from the last 6 months. So now when you submit that migraine claim, whether it's an initial claim or a supplemental appeal, now you have medical evidence that the VA cannot ignore, regardless of what the C&P examiner ignores. This is why myself, Del K. Graham Veterans Foundation, and many others push fully developed claims so much. You can't argue medical evidence, and I would like to see the veteran community take their claims into their own hands and get that medical evidence. I should say you can't argue good medical evidence.